You mentioned in your report that you expect that each wave of infections is going to be less disruptive than the previous one, and you expect that to be the case as well for the Omicron variant. But does this hold true as well for the Philippines?
Right. So, as we've looked at the economic forecast and looked at how we factor in future waves of Delta, we've had to make certain assumptions on that forecast because I think the important thing to note is that we know that there will be future waves, and we can see it, of course, now with Omicron creeping around the world right now. But we have to think that with each wave, the economic impact will be less than in the past for a couple of reasons. One, the story you mentioned about the vaccine rate rising in the Philippines, and this is critical. And we have seen that across the Asia-Pacific region anyway, that there's been a real uptick, an elbow in the curve, if you will, in terms of the acceleration of vaccination. Second, that most countries have invested in their public health systems, that there's a greater capacity now to handle COVID patients, increased number of intensive care units or beds or isolation beds for COVID patients. And third, and here I think the Philippines is an example here again, is that governments are learning how to manage social distancing in a way that doesn't shut down the entire economy. And we can see this in the Philippines with its more highly focused plans for social distance measures rather than completely shutting down a city or the Metro Manila area or the entire country. So as we learn, as we invest, and as we vaccinate, the impact of COVID should be less and less. Now, it doesn't mean it's not going to happen. That doesn't mean that the new waves of either existing variants or a new variant won't come along again. But that unless there is a really significant change that makes it difficult to deal with a certain variant, that the economic impact should be less.
Mm-hmm. Now, you mentioned three factors. Among the three, of course, for sure, in terms of social distancing, that's where the Philippines at least has been very strict with. But when it comes to vaccination and the public health system, have we created enough defense against a possible entry of the Omicron variant?
Well, I do think that these are areas that the Philippines has to be really highly focused on, as really all countries in Southeast Asia. The vaccination rate in the Philippines still isn't at what some might consider, say, a level that would create what you might call herd resilience. And there is a ways to go in the Philippines to get the vaccination rate up to 80, 90%, up where some of the other countries in the region are. So the fact that the Philippines has these special vaccination programs, these couple of days where they're trying to really get the vaccine out, if this can be done over and over and over again, that would be good. The good thing is that the supply of vaccine doesn't seem to be so problematic. But as you mentioned actually earlier as well, that there's some vaccines are beginning to expire. That is becoming a bit of a problem as time passes, that those vaccines have to get out and into the arms of the population before they expire.